I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have a great guest with us today, Michael Seereiter.
Hi.
Michael, you are the president of the New York Alliance for Inclusion and Innovation, which is where we're coming to all of you from today.
Yeah.
Michael, tell us a little bit about what you do in that role first.
Sure. So should I do a little bit of what the New York Alliance is first, maybe?
I'd love for you to do that.
So I do have a prepared elevator speech on this, which
Excellent.
comes in handy. So the New York Alliance is an association of about 135 provider organizations throughout the state of New York, representing that of those organizations that serve individuals with a variety of disabilities. Our common denominator amongst all of the members is that all of these members provide services to people with intellectual and developmental disabilities. And we really kind of break our work down into three main silos of work. One is policy and advocacy, which I think is what most of our members are looking for us on a regular basis, looking to us for on a regular basis. So we have several registered lobbyists. We are in regular communication with the governor's office, with the legislature, and the State Office for People with Developmental Disabilities, the Department of Health, and other agencies that impact the service delivery system for individuals with disabilities. The second category of service for our membership is what I would categorize as education. Conferences like this are an excellent example of that. We are hosting a number of those on a regular basis throughout the year. I think 4 in person now, post-COVID, with a lot of webinars, some of which you're familiar with.
Yeah, I've had the pleasure of presenting webinars for this organization for clinical education for staff.
Love that.
I'm actually working on a couple of new ones right now that'll be out soon.
And that education, I think, is a really good example of where the association can play a really pivotal role for helping to advance the policy to practice dynamics that I think, or the gap that sometimes exists, and making sure that those best practices are kind of spreading like wildfire as best as possible through the service delivery system. And then the last category of service is what I would kind of call technical assistance. We have a number of grants through the State Developmental Disabilities Planning Council and other grant funding organizations that really allow the organization to kind of sit out on the leading edge, sometimes even the bleeding edge, of what is next. What is the next best way in which we can support individuals with disabilities to live independent lives, with greatest opportunity to participate in their communities. And that technical assistance, which we oftentimes make available to not just the New York Alliance membership, but anybody, any of the provider organizations typically, that tends to bleed into our policy and advocacy work. So we are very pleased to see a number of the initiatives that we've been talking about for 10 and 15 and 20 years from a technical assistance perspective, and talking about those at our educational events like this. We now see them kind of coming into the fore. Direct support professional credentialing is a good example. Supported decision-making is another example. I mean, there's any number of these. Another example just learned last week, actually, the State Office for People with Developmental Disabilities is going to include in their next HCBS services waiver amendment to the Centers for Medicare and Medicaid Services, assistive technology as a billable service, which we've been talking about for almost 10 years. Which great opportunity to promote that independence.
So you said assistive technology. What does that mean? Help everyone understand that.
That means using technology to augment the supports that are available from direct support professionals and other individuals to help individuals live more independently. And I would make a very strong, bright line differentiation between assistive technology and what I would probably consider as monitoring, if you will.
Right.
I'm talking about devices. I'm talking about technology that allows an individual to not need the types of supports that might otherwise be provided by a direct support professional, which I think is particularly important at a time like this, when we have a dearth of those individuals, and I quite frankly don't see an awful lot changing on that forefront for a long time. But those can be supports that really simple things, off-the-shelf things like the ability just to have a phone to support an individual in supported employment so they don't have to have a job coach. Instead, they can text or they can FaceTime or they can, another way to get in touch with that job coach. Smart technology using stoves that shut off after a certain number of seconds when there's nothing on the stove. Call devices. I mean, we now have Alexa and we have now Siri, where you can literally call out into a room and you could have that make an immediate connection to a DSP if you need that support. But we've also seen organizations in our membership be really successful in using that technology and pushing it into homes, into residences, so that an individual who does not have a great amount of mobility has the ability to call out and say, hey, Alexa, lower the shades. Hey, Alexa, turn the temperature to 72 degrees. Hey, Alexa, turn on the TV to channel 72.
And many of us see those things as novelties, but for other people, it can give them more independence in life.
It's incredible. It is an incredible opportunity, and we see more and more of that as our society is becoming more and more technological.
And New York Alliance advocates for changes like some of the ones that you've mentioned and really plays a big role in moving this field in a way of more person-centered supports and services, more independence for people with intellectual and developmental disabilities in the state.
Those are the words that are part of our mission, vision, and values. Those are the things that we very intentionally created in our mission, vision, and values when we merged the two organizations of NYSRA and NYSACRA 5 years ago and created the New York Alliance. That's the stuff that we're made of.
So you sound like you're just maybe slightly busy with some things. Let's go back and talk about your early experiences with people with intellectual and developmental disabilities. Sure. I understand it's pretty close to you, and kind of take us through how you got to this point.
Professionally, actually, I find myself almost having fallen into some of this work. I began working in the state legislature back in the late 1990s and early 2000s, and had the opportunity to work with a member of the legislature who had an option to take one of two committees, one of which had oversight responsibilities for services and supports for a number of populations, including people with psychiatric disabilities, developmental and intellectual disabilities, and so it was kind of like an aha moment for me where I never kind of realized it, but I've been an advocate for people with disabilities since I was about 2 years old when my brother Christopher was born with Down syndrome, and that's just kind of part of the DNA. I never knew anything different, right? And I have a strong enough interest in the public policy issues, particularly at a state level, I've been kind of trying to, what's the right word? Kind of get all the different perspectives on how we actually advocate and successfully see change. So I have worked in the state legislature on these issues. I have worked in in an advocacy organization, not representing provider organizations, but in a more strict advocacy role. Then in the governor's office with oversight responsibility for these services and supports, including substance use disorders. Moving to the Office of Mental Health in a state agency to understand how does that policy trickle down, how do we implement those types of things, and then now out here to an organization that primarily represents provider organizations and really trying to push the envelope.
You've got a lot of experience from a lot of different perspectives that makes you a great person for the job you do now. Certainly. We're talking about advocacy. One of the things that I've seen more of, and which really needs to be moving in this direction, is self-advocates. Mm-hmm. I bet you work with a lot of self-advocates.
We certainly do, quite regularly. My partner in crime, Ann Hardiman, who you know well,
I do.
Has been a longtime advisor to the Self-Advocacy Association. We work very closely with them on a number of things. We make a very intentional effort to include self-advocates and family members in the work that we do. Having been on the receiving end of that advocacy now in 3 or 4 different roles, I have seen the most effective advocacy come when it is a kind of a complete picture, if you will. In this world of intellectual and developmental disabilities, it is oftentimes the provider organization executive, let's call that. There's someone in the administration talking about the larger challenges that the organization has and what they're advocating for, and bringing along with them a direct support professional who works for them, talking about what does that mean on the ground, right? And having that direct support professional also be bringing along the individual that they support and the family member of that individual that they support, so they can all speak about their experience in the system and what they would like to see changed from their respective positions, but in a way that complement one another. So that, and I'm not trying to suggest that they need to be an echo chamber for one another. Each stakeholder role has a very distinct and important role. But when we're all talking about the same things, boy, we really can't find enough DSPs. We're struggling to get qualified DSPs. We're struggling to make sure that you can go right down the list. When we're all facing those same issues and we can talk about them from our respective positions, it makes a very compelling case to policymakers.
And it's one thing when an administrator says we can't find enough DSPs. It's another thing when a person with a disability says, I can't find someone to help me with my activities of life.
That's right.
Basically. And I can no longer do this because I can't find assistance.
Yeah.
That has a very different impact. So you are saying the same thing,
right,
but the impact of each person's message and makes it more impactful.
It drives the story.
Yeah.
It drives the message home in very powerful ways. And it's an interesting kind of case study, if you will, of how things have changed over a period of 20 and 30 years. We used to almost exclusively go in with that message before, which was, hey, provider organizations, we do good things for people with disabilities, give us the money that we need. The family members essentially said something similar, and the self-advocates who were involved would say something similar. Now we need to go in with a very different approach where it's much more data-informed. We need to go in and say, hey, we're at a 17% vacancy rate, we're at a 30% turnover rate, and this is the impact that it has on this individual's life, on the family members of this life. They can tell you the story. These are the raw numbers. This is what we're dealing with. Here's the story. And that's now how we have to kind of approach the advocacy to make sure that we ring that bell, if you will, from an advocacy perspective, and compete in an environment where we're constantly fighting for and competing for limited resources.
So we talk a lot on this program about health issues, health initiatives, things we see in terms of health and wellness. Are there some things that you and your organization work on or focus on related to improving health and wellness in this field?
I could go in any number of different directions with that question.
Pick one.
Or
two.
I'm a bit of a policy wonk by experience, I guess. So I'll probably take this to the conversation of the 1115 waiver that we're currently talking about.
And explain what that is a little bit
Happy
for people.
To. So the New York State has decided to follow. Let's back up 10 years. 10 years ago, the state of New York applied for and was successful in getting a delivery service delivery system reform incentive payment program grant of $7 billion, which was intended to try to address some of these health equity issues, but really came at it from a very hospital-centric perspective. Our provider organizations and the stakeholders in our system tried to participate in that, but not very successfully. Now the state of New York is making another application to the federal government, the Federal Centers for Medicare and Medicaid Services, for another 1115 waiver application, which would allow something somewhere in the neighborhood of about 10 or $12 billion to come to New York State and to try to address these health equity issues for a variety of populations. And do so in a slightly different way than it did before, which was more the hospital approach. This is really more focused on community-based organizations. We spent a lot of time this past year of 2022 trying to make sure that we, as the IDD community, were included in the documents that were being put forth by the state of New York to the Centers for Medicare and Medicaid Services. And there are probably 13 places or 16 places where it specifically says OPWDD and stakeholders. Now we have to figure out, well, how do we effectuate that? Because the challenge is that the way that the state of New York is envisioning this is that most of this will happen in a managed care environment. Managed care is not how we deliver services in the OPWDD sector right now. We have been flirting with that for 13 years, but it has not yet happened, and I don't see it happening in the immediate future, at least.
I was going to ask you that. If you had a crystal ball, what did you see in terms of that movement? Right
now, we're seeing the State Office for People with Developmental Disabilities studying the issue of managed care for this population, and I think through the way that the Commissioner Neifeld has articulated it, is that they're looking for a menu of options, not just kind of a thumbs up or a thumbs down on the model that was put forth many, many years ago and has kind of been, kind of hotly debated in the sector since that time. So, this is a great opportunity for us to incorporate a population of people who have 2.5 times the length of stay in hospitals and emergency rooms than the rest of the Medicaid population, let alone the rest of the general population. Right. And hospitals and hospitals and emergency rooms are not the place anybody wants to be. Yeah. Can we lower that? Can we avoid some of those? I think there are opportunities to do so, but I want to make sure that, for example, we don't want the shiny object of a lot of money kind of distracting from more of the fundamental work that we need to do in this system to kind of realign, I think, with many of our core mission and values as a system. It's easy to get distracted by that kind of, the money, right? But that can be very, very easily become a tail wagging the dog dynamic. And what we want to do is make sure that we are aligning our system in a way that pays fidelity to the concepts that this system was built on. Person-centeredness, dignity of risk, honoring choice, those concepts, which I think, quite frankly, we've lost track of over a period of 10 or 15 years. We've kind of we got distracted by managed care and other things. Okay, let's come back to our roots and design the system that we want in a way that aligns with the expectations of the individuals that we're supporting, what the outcomes they want, and the family members, what outcomes those family members want, and then figure out what the payer mix is. Then figure out how we leverage large resources coming in from the federal government to the state of New York to leverage that opportunity to improve the health outcomes for this population of individuals.
It's fantastic and much needed work.
It's a long road. It's a long road.
It is, but if we never start taking the first steps towards it, we'll never get there.
Yeah, absolutely.
And you're doing it, and that's fantastic.
Thanks.
So one of the things I like to do is have our guests offer 3 things in 3 minutes. I'm not going to hold you to either of them, but do you have some things you can offer to people that are listening that they can do in their own worlds, in their own lives, related to improving support services, health, wellness, health equity, whatever, for people with intellectual and developmental disabilities? Words of wisdom.
I may go one of those dynamics where it's this thing 3 times. Getting involved and getting involved, I think, is probably one of the best examples of what we need to do as a system and as a population.
When you say getting involved, what does that look like?
Particularly on the policy advocacy front, we need to make our voices heard with policymakers. As I said before, it's a dynamic of competing for increasingly scarce resources. Well, the resources continue to go up, but the competition for those resources has far exceeded the pace of the growth of those resources. We need to figure out how we as a society start to make sure that the population of people with disabilities remain a priority, not just a one-shot, but
Agreed.
Remain a priority in public policy conversations. So that means getting involved. That means making your calls to your legislators. That means meeting with your legislators, sending the emails, participating in rallies, getting involved and making sure that policymakers become familiar and comfortable with our community, as they should be, but looking at our community as part of a larger community and one that they have particularly strong connections to. If we can do more of that, we regularly suggest that our member organizations invite their local elected
Absolutely.
Officials, senators and assembly members, to, hey, we have an event coming up. Why don't you come and join us? It's an opportunity to shake a hand and get your, to get your face on TV, but it's also an opportunity to get to know the organization.
And little things like that can have a huge impact.
Gigantic.
I mean, we did that with medical students, having medical students just come into the program and meet people with disabilities and recognize who they are as people, and seeing them outside of the clinic setting really has an impact in how they view people with IDD.
Absolutely.
And same thing with legislators and anyone else.
That's, I think, particularly a great example because it's very much like kind of the experience of where we've talked about police officers only seeing people in kind of their worst
situation.
Yeah, exactly.
Yeah.
And you kind of do this like, well, that's what everybody. No, it's not. I mean, here is a population of people who happen to have some differences, and if we can create some opportunities, thinking creatively and thinking, with ingenuity, we can create real opportunities for those individuals to participate in our communities and to help redesign our communities to make them more friendly for this population of individuals. I think there's great opportunity there. There's a real significant challenge, I think, in our system right now. We were talking about DSPs before. There is a dearth of direct support professionals, and I, quite frankly, don't see anything that changes that in the foreseeable future. Even if we were to talk about wages at $25 an hour and more, because we're competing with a sector that has the ability to raise prices. That is not what happens here with government-funded services.
To touch on that, $25 an hour would be and should be should be there. One of the reasons we're doing this podcast is to help people understand that this is more than a job. Well, first of all, that it is a job that you can consider, so at least know what this is. But secondly, that it's more than a job, it's a career. It can be a career. It can be a ladder to so many other positions. So many people that I've talked to have started as a DSP, and now they run an organization. Yeah. There are many opportunities here, and not only that, but you're touching lives of people, and it can be very challenging, but it can be very rewarding and very fulfilling. And those types of things do have an impact on where we work.
I can't agree more. I actually was a DSP for about 5 years myself on a part-time basis, and there are great opportunities to do that. And quite frankly, I think that's one of our hidden powers, if you will, is that we as a sector of services supporting individuals with disabilities have the opportunity to try to make that as welcoming of a culture and as positive of a culture as possible. And we recognize that no one's going to get rich doing this work, being a direct support professional, being a frontline supervisor, even in the managerial roles. We understand that. But there's something intrinsically valuable about this if that's something that speaks to you. I mean, does not speak to everyone.
No.
But if we can tap into that and we could, quite frankly, get a little bit of, I think I call it relief from government to be able to think a little bit more creatively, to have a little more space. Mm-hmm. We have a colleague who will be speaking actually at the conference, Hans Meissner, former executive director of the Arc of Rensselaer, and his book is called Creating Blue Space. People need the space in which to kind of sit back and realize, to examine the situation and to be able to experiment with different ways to kind of, well, would this work for you? And would this work for you? And we have created a culture regulatorily here in New York particularly that has driven out most of the innovation, quite frankly. We are holding on by our kind of like fingernails, right? And I think that's one of the major things that we're going to need to wrestle with over the next several years is recognizing the dearth of DSPs and probably nothing changing significantly on that front. How do we make better use of the time, energy, and resources that DSPs and frontline staff can offer to support individuals to help them live their best lives? We're going to need to think very differently about how we let go of some of what we've created in the system, which was admittedly, I think, borrowed from and exported from the institutional system 50 years ago. We've taken some of those things with us and we've never let them go. And we're going to need to create the space for DSPs to stop doing paperwork and start paying attention to people.
It's funny you say that because one of my colleagues talks about how what we've done in so many ways is we've moved people from large institutions and put them in little institutions in the community, which, and that's kind of what you're talking to, is we've borrowed so many of the practices that still are in place in the community setting that you would never see in your own home. Yeah. Right. You would never do these things in your own home.
Fire drills at 2 a.m.
Exactly.
4 times a year.
Gosh.
Right.
Yeah. So things like that. And what you were describing is really creating a supportive environment for workers, for the direct support professionals, figuring out what they need, what would make this job be a very good choice for them. So, gosh, we could probably talk for hours, and I'm going to pick your brain at another time. You'll be a repeat guest at some point.
I would be happy to.
But I want to give you the opportunity. Is there anything else that you'd like to say or add or touch on that you want people to hear?
I think we've covered enough of the bases there. Yeah,
Okay.
That's good.
Well,
I would welcome the opportunity to continue this conversation.
Excellent. It's given me a lot of things to think about, and I know it's given everyone out there. I really thank you for the for the opportunity to talk with you today. Thank you for joining us here, but more importantly, thank you for the amazing, incredible work that you do in this field.
Thank you, but likewise, you are doing your own share. We're all doing our part on this, right? And I think the association can play a valuable role in helping to kind of amplify those voices that need to get heard more loudly and more across the board. So we're happy to play our part, but we want to help continue to drive that conversation.
Let's keep on working together along with everybody else out there to do this.
Great.
Thanks.
No problem. My pleasure.